My name is Maha Albdour. I am Associate Professor here at the College of Nursing, Wayne State University. I am also the Director for the PhD program. So my research focuses on psychosocial stress and its effects on adolescent and young adult health. I mainly look at mental and physical health, and I also incorporate biological measures of stress in my research. So I utilized blood samples. I also utilized hair cortisol, again as a proxy for biological measures of stress. And I'm really passionate about adolescent and young adult health because I believe that adolescent and young adults who receive health support, they grow up to be healthy adults. My reason to pursue this, I come from a public health nurse background, and a lot of my internship in my master worked with immigrant adolescents and did a lot of outreach and health education for adolescents and their families. And I thought this is a great place to do research, and I continue my PhD and I focus on that population just because I found a great need in that population, and also a gap in knowledge and gap in research. So I thought it's a great opportunity to do something and make an impact for such a disadvantaged group. Majority of my work focus on disadvantaged and minority adolescents and young adults, mainly immigrants and African American adolescents and young adults. I do believe that immigrant adolescents really experience a multifold of stressors prior to immigration, during immigration, and after. And especially if they are first generation, second generation have their own challenges too. But I do believe all these psychosocial stressors have an impact on their health, both mental and physical. I was able to really work on that in my research, and we found that adolescents who experience psychosocial stressors such as discrimination, bullying, or adverse childhood experiences have moderate to severe mental health symptoms, but also their physical health is affected. They might show risk factors for cardiovascular and metabolic disease. I was able to develop a model for cumulative stress among Arab American young adults, basically quantifying the impact of their multiple stressors, experiencing adverse childhood experiences, and also bullying, in addition to discrimination, really had a significant impact on their mental health. Their cortisol levels were also like a plateau or decreased, which is the opposite of what we hypothesized. It's mainly reflect that the chronic experience of disease really deplete our defense mechanism and response to stress, and that's why they exhibit also some physical health symptoms. So probably that's one of the highlight in my work, where we were able to really show using data that psychosocial stress have both mental and physical impact. I also recently concluded a study that looked at Arab American adolescents and their parents. This study used dyads data, so we looked at both the adolescent and one of the parents. And we looked at cross-generation, how psychosocial stress really have an impact. One of the interesting findings that parents' acculturative stress really had an impact on the risk of metabolic syndrome of their kids. Also, the kids' experience of psychosocial stress, especially acculturative stress, had an impact on their physical health. They had more risk factors for metabolic syndrome. And metabolic syndrome, it's like the precursor for cardiovascular disease and more chronic disease such as diabetes. I think these two projects demonstrate the underlying thoughts that psychosocial stress early in life can really have a great impact on physical and mental health.